Hello, welcome to Dorivan Oski, your pathway to Oski success. Today we are going to basically talk about NMC Oski and basically for beginners. So if you are new to Oski, this video is made purposely for you. This video is just going to introduce you to the Oski clinical skills and then what the Oski is about. So feel free, watch the video to the end, and if you have any question, put it on the comment section and I'll attend to it. Okay, so let us proceed. So basically this video is made for registered nursing adults. So it's for the adult nursing nurses only. Okay, so let us start. All right, so just an introduction to the OSCE. So OSCE consists of 10 stations, and then it has a total testing time of approximately 3 hours. So for the adult nursing, 4 of the stations are scenario based, and it covers the various stages of the nursing care process. So the first 4 station is what we describe as the API stations. The API stands for assessment, planning, implementation, and evaluation. The next 4 stations deals with clinical skills. So we call it the clinical skill stations, where practical clinical skills are assessed. Each station takes about 6 to 15 minutes to complete in the clinical skill station. The remaining 4 stations, or the remaining 2 stations, sorry, are silent stations. That is the professional value station and the evidence-based station. And these are silent stations that takes 10 minutes to complete. Now let's talk about the API stations. So for the API stations, as I said or indicated earlier, it deals with assessment, planning, implementation, and evaluation. And it works on the nursing process. So how you assess your patient, and then with the planning, you formulate some nursing diagnosis. Implementation, you'll be asked to serve some oral medications, and then the evaluation, hand over your patient to another health professional. So let's dive into it one by one, starting with the assessment station. So the assessment station takes 20 minutes to complete. During the station, you take the patient's vital signs or observations. After taking them, you have to record them on a chart. So you can be given a scenario where you'll be using the National Early Warning Score chart, known as the new score chart, and then the Glasgow Coma Score chart, also known as a GCS chart. As part of this station, that is the assessment station, you will be asked to complete a full assessment of the patient. So we describe it as the A to E assessment. So airway, breathing, circulation, disability, and exposure. Same on the assessment station, you'll be asked to carry out a holistic assessment of the patient's physical, psychosocial, spiritual, and sexual needs. You can take notes during the assessment. However, note that the notes that you take will not be marked, but it will be needed during the other stations for your reference. Example, during your planning station or the evaluation station, where you might get some information from it to formulate your nursing diagnosis, or when you are handing over your patient to the other health professional. All right, now let's take the planning station. So at the planning station, as a candidate, you are required to create or formulate two personalized care plan or nursing diagnosis of the patient's needs. So you formulate two nursing diagnoses, and then you set some measurable and achievable goals, and then you get some interventions to address the patient needs. So that is all about the planning station. Now moving to the implementation station. At the implementation station, candidates are required to safely administer medications, and then you have to follow the rights of drug administration. That's the 5 rights of drug administration: the right patient, right drug, right route, and right time, right dose, and all that. You have to also check for patient allergies, and you have to adhere to infection control procedures. Throughout the procedure, you'll be required to communicate with the patient and then inform the patient whatever you are doing. And then you have to document all the medication you've administered accurately on the medication administration record chart within the scale. So this implementation station takes approximately 15 minutes for you to complete. With the evaluation station, the evaluation station focus on handing over the patient that you've been taking care of to another healthcare professional. So you have to speak clearly, because this is a verbal access station. So even though you'll be given a document to write on, but those documents will not be marked. So there might not be the need to write on it, but if you want to write on it for your reference, you have to make sure you are able to complete the station within 8 minutes. So you have to structure your handover using a format called the S-bar. So situation, background, assessment, and recommendation. So that is what the evaluation stations is all about. Now on the clinical skill station. At the clinical skill station, you'll be assessed on 4 practical clinical skills. And then each skill takes about 6 to 15 minutes to complete. So some of the skills, the minimum is 6 minutes and the maximum is 15 minutes. So that is what it's all about. So clinical skills that you could be tested on include administration of inhaled medication, administration of suppository, aseptic non-touch technique, that's the ANTT, and then wound assessment, blood glucose monitoring, bowel assessment, catheter specimen of urine, fluid balance, intravenous flash or visual infusion phlebitis assessment, and then midstream of urine sample collection and urinalysis, known as the MSU. You also have nasopharyngeal sanctioning, nutritional assessment, oral care plan, oxygen therapy, pain assessment, peak expiratory flow rate, patient pressure area assessment, subcutaneous injection, removal of urinary catheter, insertion of nasogastric tube, and then intramuscular injection. So among these skills, 4 of them will be given to you, the candidate, to assess your clinical skills. Now let's move to the professional skills or professional values station. So at the professional value station, it requires you, the candidate, your understanding of the ethical principles, how you can effectively communicate and then reflect and learn on your experiences. So some of the professional values that you can be assessed on include bullying, concealment of birth status, confidentiality, drug error, false representation, false observations, hospital food, impaired performance, laboratory results, possible abuse, professional confrontation, racism, social media, and then witness abuse. Let's move to the next, which is the evidence-based station. So with the evidence-based station, you'll be given an article, which is like a literature review, and then from that article, you are going to answer or respond to the scenario. So some of the skills that you are likely to be tested on include ankle sprain, autism spectrum disorder, bedside handover, cervical screening, cranberry juice and urinary tract infections, dementia and music, diabetes, female myocardial infarction, fever in children, pressure ulcer prevention, restrained saline versus tap water, smoking cessation, and use of honey dressing for venous leg ulcers. Osce can happen in various settings in the clinical, in the hospital or whatever. So Osce settings. Osce can be set in various clinical environments. This is just to mimic the real world that nurses work. So we have the hospital setting and then the community settings. So at the hospital setting, your scenario can be around the medical surgical ward, emergency department, outpatient department, medical assessment unit, surgical assessment unit, etc. All the various clinical hospital settings can be used. And you can also get community settings. So with the community settings, you are likely to get a scenario which is like a care home, nursing home, or even the patient's home. So these are some of the settings that you are likely to meet in your OSCE. So in each of the stations or the skills that you'll be tested on, there are various tools that you are likely to meet or you are likely to use. So these are some of the tools that you are likely to meet, especially in your API station and the assessment station. So for the API station, when you get a community scenario, you can get a condition like a patient suffering from depression or anxiety. And then as part of the assessment, you are to complete a news chart, that's the National Early Warning Score, and then a PHQ-9, known as the Patient Health Questionnaire chart. When you get same under the community, you can get a condition like Alzheimer's disease, and then you complete news chart and then say CIT. Say CIT is says cognitive impairment test. All right. And then you can also get dementia, diabetes mellitus, or patients suffering from malnutrition. And you'll be completing news plus news chart and then malnutrition universal screening tool known as the MAS tool. You may also get a homelessness patient. With that one, you only complete the news chart. And then a dying patient or patient on end of life, you complete only news chart and the other relevant aspect of patient care. When you get a hospital scenario, these are some of the tools that you are likely to use. So if you get a condition like subdural hematoma, you complete GCS chart. You may get asthma. So the GCS chart is the Glasgow Coma Scale chart. And then if you get conditions like asthma, pneumonia, chronic heart failure, fall and fracture, hernia, ectopic pregnancy, which might be in a pre-op or post-op situation, you'll be asked to complete only the news chart. That's the National Early Warning Score chart. Okay, so this is the end of our presentation. So do well to watch to the end, and if you got any concern or questions, put in the comment section and I'll attend to you. Thank you.